So let's talk about inflammation, especially important in that sort of preoperative as well as postoperative process. So the key here is that you're not trying to completely suppress it, but you want to control it because it can be a cascade and it can be accumulative. So it's required to be inflamed or have inflamed tissues for healing, but if it's too excessive, it can be troublesome for the recovery. It's why we do prehab. We want to reduce inflammation in the knee or for the shoulder, etc. So preoperative anti-inflammatory nutrition is important. So one big thing is omega-3 fatty acids. Now, again, there can be an area where you have too much of these and there's a bleeding risk for surgery. But again, it's important that you understand this, and at post-operatively even better. So berries, green tea, etc., those also can help with that in sort of a holistic approach. And then the standard nutrients, which we've talked about, and you see ad nauseum in the news, zinc, magnesium, and vitamin D. These are really pro-anti-inflammatory modules, and they can be really good for supplementation and are usually part of some of the packages that are offered. So omega-3 is important and modulates the inflammatory signal. It improves, again, muscle protein synthesis. The key here is to get those quads of the strength back faster if we can. And then you want to it also can help reduce excess postoperative inflammation. So again, there's a fine balance between all of these, but it's important to understand that. Again, the key here is modulation, not suppression. This is different than doing non-steroidals. Again, with those, you want to reduce the amount of NSAIDs the first few days before surgery because it can increase your bleeding risk. A bit different with these supplements that we've talked about.